Thank you, Mr. Chairman. First of all, to Dr. Anson, in the Recovery Act or the Stimulus Act, money was appropriated for health IT. Is your organization aware of, is that filtering down to you in terms of access?
Not yet. The money that was provided towards HIT adoption under the Recovery Act is provided in additional incentives for physicians. And an example right now, under Medicare, CMS right now, starting at the beginning of the year, for each Medicare patient that I see and bill, I get an additional 2% if I file my prescriptions electronically. 2% for my 40%, give or take, Medicare patients isn't enough to give me enough capital to buy a new system. The concern that I have for the physicians over the next few years is that number is going down. In 2 years, will be 1% additional bonus, I guess you could call it. 2 years after that, it's 0.5%, and then after that, we're actually going to be fined for not e-prescribing. Now, e-prescribing is interesting because I've had an electronic medical record in my practice now for about 7 to 8 years or so. And I thought I was e-prescribing. I fax prescriptions when a patient comes to see me. I can do it on the computer, and it's a wonderful thing. And as Representative Moore said, the system is wonderful. I can't tell you how many patients I have who come in who say, well, what did the ER doctor put you on? Well, a pink pill and a white pill. Well, what was that? I'm not really sure. What was it for? I don't know. And with my system now, I can pull up the patient's record from the emergency room from the night before, and I can know exactly what that ER doctor thought, what he put him on, and I can give a lot better care, and I can save lives doing this. The problem with the money right now, back to your question, in the Recovery Act, it's just not accessible yet, and what is accessible isn't enough for us to put an outlay for small businessmen to put these computer systems in our office. So that's been the big problem.
Well, it sounds like a negative net effect because at the end of the day, with the mandate to do the e-prescriptions, and if people aren't able to do that with Medicare, if it's not cost effective for them to do that, then they just may not see Medicare patients.
Oh, absolutely, and eventually it's going to be an access issue. For me personally, I live in a town that is 20 minutes from where I grew up, and I see a lot of patients that my dad saw. He was a family doctor who practiced for 30 years in this rural area. And I see a lot of folks, and the Medicare folks who come in, I'm not going to be able to say, Aunt Sookie, I can't see anymore. That's not going to happen. But what's going to happen is new Medicare patients, and as the baby boomers grow up and come in, I'm not going to be able to see them. In Virginia right now, and this kind of speaks to healthcare financing in general. Medicaid reimbursement hadn't changed for 17 years. Okay, this is not Medicare, this is Medicaid, but the amount that I was paid for the last 17 years hasn't changed. Okay, I pay my nurse more, I pay the power company more, I pay more in rent, but my reimbursement or pay hasn't changed at all. So I'm operating at more and more of a deficit every year. A good friend of mine did a study in his practice, and he said, well, what if everyone paid what our best insurer pays? What if everybody paid Medicare rates? And what if everybody paid Medicaid rates? If every single one of his patients paid Medicaid rates, each one of the physicians would have been $75,000 in the hole at the end of the year. So when we see a Medicaid patient, we are losing money in our practice. And then put on top of that other requirements that are going to make us lose money. In a few years, if I don't have e-prescribing, I'm going to be fined 1.5% because I'm not doing this. It's just these, the requirements that are placed upon us, and then the administrative burden that doesn't allow us to see enough patients. It's not a financially viable model to run a small practice. So what happens? A lot of the small business physicians end up working for hospitals or larger groups, and the rural areas are the ones that suffer because When I came out, I knew where I wanted to go, and I wanted to go back and serve the people that I grew up with. And I did it, and I was fortunate to do it, but in order to do it, I decided to work for a hospital. And unfortunately, most people who come out of medical school, current medical school debt's about $148,000 when you come out of school. most of them don't see that I can move to a rural area and service that kind of debt. I'm sorry, I got away from your question. And
So that's okay. It's a good discussion for another committee.
Yes, sir.
And we're about to
Sorry
expand
about
that. We're about to expand that whole system for you here pretty soon. Mr. Robeson, a question for you on financing, and that is that for home builders, I understand that there was a requirement in multifamily housing, condominiums, say townhomes, but it dealt with FHA that it made it difficult with home builders to say you had to have a certain threshold sold before FHA financing was available. Can you tell me where that is right now from your industry's perspective?
Well, we're talking to them about getting that renegotiated. I think it's 75%.
75%?
Which is extremely difficult in today's market.
So pre-sales have to be about 75%?
Right.
Okay.
And also, there's a certain limit on how many FHA loans will be allowed. I think it's a maximum of 30%.
30%? Okay.
Concentration.
Okay. How significant is that to your industry?
That's very significant, especially if you are, well, given the financing in general, if you're in that kind of price range, FHA is the only game in town. I mean, as far as mortgage markets across the spectrum, FHA or Fannie and Freddie conventional mortgages are 75% and FHA is 25%. There is no other market. So if you're looking at first-time homebuyer condos, lower income first condos, to have a concentration limit FHA loans means you only sell 30% of the condos.
Okay. Okay. Hey, my final question, Mr. Humphreys. It just seems like, from a regulatory standpoint, what I'm hearing from my local bankers, that the control of the currency has come down unreasonably hard with a mentality of zero risk in hiking their capital reserve requirements, and that you can't have a zero risk mentality, when it comes to credit markets in a free enterprise system. Is that your view? Could you speak to that for just a minute?
Well, that's certainly my view. You can't have a zero risk mentality. The banking business is a risk business, and we balance risk versus reward constantly. That's what we do when we underwrite loans. You mentioned the controller. We're audited and regulated by the FDIC at our bank, and we feel like the FDIC is a good regulator. They're very professional. They do a good job. It's been tough for them because there is so much to do out there, and the banks need their help. But at the same time, it's a difficult market to regulate in as well because of the number of defaults in banks, et cetera.
Thank you, Mr. Chairman. Yield back on.